Good morning. I'd like for you to meet a very important American historical figure in the field of nursing, Mary Eliza Mahoney. Mary is a pioneer in the field of nursing because she was the first African American licensed nurse in the United States. Mary was born in 1845 in Boston, Massachusetts, to free slaves. Even though she entered the world free, slavery did not officially end until 1865. This meant that although not mentally and physically oppressed by a lifetime of inhumane treatment, she was still not out of the reach of the tentacles of the oppression and inequality. Even though women that looked like her had worked along white women during war times to render aid injured and dying soldiers, they were not allowed to formal nursing training or employment opportunities in the field. Mary's interest in the nursing came in her early 20s while employed at New England Hospital for Women and Children. Her employment was not that of a caregiver, but of a janitor, a cook, and a laundry girl. While conducting her official duties, she became inspired by the field of nursing and was able to convince her hospital staff, comprised of all women, staff, and doctors, to allow her to work as a nurse aide. After 15 years of service to the hospital, and with the supportive inspiration of the abolitionists and other persistence in gaining equality for blacks, the same hospital she worked for all these years allowed her admittance to, to their professional graduate school for nursing. Of the 42 students that had entered the program, only 4 completed it, with Mary being one of them. As a result of her persistence, Mary Eliza Mahoney goes down in her history as the first African American in the United States to earn a professional nursing license. The journey was not easy for Mary, nor has it been for those who followed in her heroic footsteps. Inspired by Mary Eliza Mahoney's story in the middle school and encouraged by family members in the medical field, I too have a desire to walk the path that Mary and so many African American women before me fought to pave the field of nursing. When making career-based decisions, it is important to seek out the guidance from those who have successfully entered and remained in a consistent in the field of interest. For this subject, I have the pleasure to interview Ms. Charlotte Bird. Ms. Bird provided a wealth of insight to include a historical overview of her career and what it took to get there, the pros and cons of nursing, and her point of view of the current trends in nursing. A career overview that Ms. Bird gave me. Ms. Bird worked in the nursing for 19 years. She attended a 2-year program in Pensacola Junior College. Currently, she is employed at St. Francis Health Systems here in Tulsa, Oklahoma, as a hospice referral coordinator. Throughout her career, she has also been employed as a GYN, a GI, and a post-op nurse. Ms. Bird describes herself as a strong but abrupt. Her strengths in the field are her multitasking and observation skills. Her weakness is her OCD. She finds her choosing career to be both rewarding and challenging, and it would not have it any other way. Ms. Bird provided some great advice regarding the profession. Never attempt to provide friends, family, or patients a medical diagnosis. Always refer them to a physician. Be tactful and professional when voicing your opinion to colleagues and patients because mutual respect is very important in nursing. Always leave work at work. Always follow your chain of command with concerns of disputes. Do not get personally involved with patients. This includes connecting with them on social media. You cannot fix everyone. Never burn professional bridges because you will someday most likely work with them again. Chart in real time, and if not, make sure you take great notes. Always strive to end your shift with all of your patients attended to, charts up to date, and other tasks completed. This will help the next following shift. Do not always look for the easy way out. In order to learn and grow in the field, you must take the road less traveled. The outcome is more beneficial, and supervisors will reward you for your efforts. The pros and cons of nursing. Nursing is a field that will always need employees. Nursing will always allow you to conduct your duties anonymously but supported by a great team of nurses and physicians. The entry pay level is anywhere from 40 to 60,000. The cons of nursing: dealing with difficult patients and family members. The task-oriented work can be sometimes overwhelming. Patients fluctuations: sometimes you're too busy and other times you're not. A burnout. There is an imbalance in what we do and what we are paid for. Patients will not always treat you in the way you want to be treated. and some current trends. One of the trending topics in healthcare is racism. Racial discrimination penetrates healthcare systems in many countries in the United States. This has a negative consequences for both patients and healthcare workers, leading up to higher risk of illnesses, in some cases lower standards of care of people of color. Let's take a look at the COVID-19 in the United States. Blacks were 3.57 times more likely to die from COVID than whites. Black males and females have a lower average life expectancy than white males and females. Black males are affected by high blood pressure at a rate of 42.4%, while white males are 30.2%. Ms. Bird had these points to make about the subject matter. There are racial disparities in healthcare providers, but not just for African Americans, also for Hispanics, Asians, and Middle Eastern Americans. Cultural awareness in nursing is important because we do not take care of the body, but we also should take care of the mind and soul. It is good business and good service to cater all populations of the world. Hands down, the diversity should be a necessity, not an option for all employers, healthcare included. In conclusion, currently in the United States, it's the health disparities for African Americans are an epidemic of proportions. Black women face higher and worse outcomes from breast cancer, and black men are more likely to be diagnosed with prostate cancer. One of the primary reasons for these numbers are the mistrust in healthcare providers. Research is finding that black patients prefer healthcare providers that look more like them. However, due to discrimination in institutions such as medical and nursing school, blacks are underrepresented in medicine in the United States, inspired by Mary Eliza Mahoney, family members, Miss Bird, and a desire to decrease gaps in healthcare in order to save lives. My plans are to pursue a nursing degree as valiant as a career as Eliza Mahoney. I'm